The views and opinions expressed on any program are those of the producers and/or the persons appearing on the program and do not necessarily reflect the views and opinions of FRC Media, Bristol Community College, or the City of Fall River.
Thank you for joining me today. I'm Keith Tebow at FRC Media. World Hepatitis Day comes up later on this month of July. You know, many of us may have heard of the disease of hepatitis. Many of you may have experienced it or may know someone who experienced it. But many others, this person included, really has very little information on hepatitis. And we're going to focus on that a little bit today through our friends at the HealthFirst Family Care Center. I'm joined today by Dr. Lynn Taylor. She is an internal medicine doctor at HealthFirst. Dr. Taylor, thank you for joining me. I appreciate it.
Oh, it's a wonderful privilege to be here and talk with all of you, and happy World Hepatitis Day coming up on July 28th everywhere in the world.
Yeah, absolutely. So, you know, when people hear of hepatitis or viral hepatitis, what is it in general?
First thing to know about viral hepatitis is that we all know someone living with viral hepatitis, whether we know it or not.
Right.
We may have a parent, a partner, or a neighbor, a colleague, a friend, a child with viral hepatitis. We might not even know. This is such a common health problem. But unfortunately, because of the stigma that can be associated with viral hepatitis, people don't talk about it. So this is really everybody's issue. Mm-hmm. And when we talk about viral hepatitis, we're talking about a family of viral infections, that is, infections caused by little microscopic creatures, infections that can get into our body and then silently, without us feeling anything, get into our liver, replicate, and then cause liver damage, liver failure, liver cancer, liver-related death, which is a very painful way to die, and other problems all around the body. These can be called silent infections because we may not feel anything for years until we have pretty extensive liver damage.
Yeah. How is it contracted?
So there are 5 different types of viral hepatitis, A, B, C, D, and E. And there are different ways of contracting different viruses. So the viruses that cause the most damage with a chronic ongoing infection that can lead to serious health problems, that's hepatitis C, hepatitis B, and hepatitis D, which we also call Delta. Hepatitis B is the most contagious. It's much more infectious than HIV and then hepatitis C. It's a sexually transmitted infection. It's transmitted through household, through sores and cuts. So if grandma or grandpa had hepatitis B and was holding the baby could catch hepatitis B. Through parenteral, through blood, we can also catch hepatitis B. So not through stool, not through urine, not through breast milk, but many bodily fluids can transmit hepatitis B. Hepatitis C is very different. The only bodily fluid that contains hep C that then can transmit this to someone else is blood. So hep C is a blood-borne infection. So someone else's blood that contains hepatitis C has to get into our bloodstream. And then Delta, D is like B, and A and E are very different. They cause a brief infection that goes away on its own, and that's by mistake. It's a fecal oral transmission. Somehow we ingest tiny particles of viral hepatitis A and E, and that really gives us a very bad diarrheal illness. But those two, A and E, go away on their own.
Now, in terms of the different types of hepatitis, you know, there are many, and I know B is one of these, and probably C and D as well, that they're chronic. People think, oh, I have it, I'm done with it, but that may not be the case, correct?
Absolutely. And the biggest health burden, and the reason that these viral infections, B and C, and especially C in the United States, are among the leading causes of infectious disease death in the United States, have to do with the long-term chronic infections in the liver, going on unknowingly while we don't feel anything until the disease is very advanced. So when we first catch hepatitis C, the immune system can battle with it, and maybe 2 out of 10 people will find the immune system wins and we spontaneously clear it without even knowing this happened. But 8 out of 10 people will develop a chronic ongoing infection that will stay there and cause damage without treatment. B, similarly, we can catch hep B. We have a higher chance of clearing it on our own when we're adults and we acquire hep B. But if we don't beat it on our own with our immune system, we will have a lifelong infection. Hep B, we don't have a cure for. We have great preventive tools that we can talk about, but no cure. Yeah. And D is like a little backpack on the floor. It's not going to get up and come walk around on its own. It needs to go on someone's back. D only exists if B is around. It's like a little backpack that sits on top of hepatitis B.
Now, you mentioned that, many of us may have hepatitis and not know it. But when the time comes and symptoms arise, what are some of those symptoms so people can be aware of that?
So most of the time we don't feel anything when we first catch these infections, which is why we want to we'll talk about who should get tested, we want to go out and get tested. Because in the common sense model of illness, we say, hey, I feel fine, so I am fine, but not when it comes to these infections, where many of us are supposed to get tested. But what can happen is the liver, if you've ever seen raw liver from another animal or raw meat, it's mushy and soft, right? Because blood flows in and blood flows out.
Right.
Because the liver's the filter in the body, one of the key filters in the body. The liver has other roles. It's a factory, it's a storage tank, it helps with digestion, but lots of blood flows in and out. And the liver gets annoyed by these viruses sitting in there and replicating and churning out more baby viruses. And the response of the liver, unfortunately, is to lay down scar tissue. So it's as if we had a sprained ankle and we were wrapping it in an elastic bandage, and we kept wrapping and wrapping and wrapping, and we strangled their ankle and cut off the blood supply. We'd make the injury worse. The laying down of the scar tissue, which is our body's response to these viruses in the liver, actually creates scar tissue. And the liver, instead of being soft with blood flow, gets harder and harder and harder. And at the end of that process, we come to a point called cirrhosis of the liver. That can also be caused by things other than viral hepatitis, such as alcohol in excess, but the liver is scarred. And even then, once we have the cirrhosis of the liver, most people die of something else. But the liver having cirrhosis means the liver can get, with hepatitis C, liver cancer. With hepatitis B, we can get cancer within a few years of infection. You don't have to go through cirrhosis. But the cirrhosis can lead to the liver conking out. And as the liver fails, we start to see swelling in our body. We can get swelling in the ankles and the legs. Now, if we see someone with swelling in the ankles and legs, there are other causes. That might be from other things, not as serious. We can get what's called ascites. The belly can start to fill with fluid, and it can look like a person of any gender is 10 months pregnant. The whites of our eyes can turn yellow. Now again, the whites of our eyes can turn yellow from other things that are not so serious. We can start to have problems where our blood is not clotting well. The liver helps to keep the blood so that it's not too thin and it's not too thick. Suddenly that process is not working very well, so the blood can become thin. We can have a lot of easy bleeding, easy bruising. And importantly, the liver filter can slow down. And so a lot of chemicals that should be filtered out of the body by the liver, we find that that process slows down. So we can develop what's called hepatic encephalopathy, where these chemicals are in the body and they can make us very confused. We can lose our balance as the chemicals bathe the brain, the balance center, and eventually people can actually go to sleep, go into a coma. So as the different functions of the liver fail, we can see different symptoms depending on what's failing.
Are there any demographic areas that may be of higher risk than others, or individuals, or even just in terms of their medical condition that may put people at higher risk?
Sure, and it's different when we think about hepatitis B and hepatitis C. So with hepatitis C is the predominant problem in the United States. There's more hepatitis C than hepatitis B in the United States. Globally, it's the reverse. It's more hep B than C. And that has to do with the fact we were doing a great job vaccinating. We should talk about the phenomenal hep B vaccine. But C, we have over 4 million Americans living with hepatitis C. It was, until very recently, one of the leading causes for liver transplantation. And again, one of the leading causes of infectious disease death in the United States. Hepatitis C is acquired through infectious blood from an individual with hepatitis C getting into our bloodstream. So very efficiently transmitted if we're struggling with injection drug use. So if we're sharing needles, syringes, cotton, cocoa water, anything used to inject drugs. So we want to help people with that health problem. This is a medical issue. We want people to have access to methadone treatment, buprenorphine treatment, also called Suboxone. We have Suboxone, buprenorphine at HealthFirst. We want to help people have access to a brand new syringe with each injection. We want to help people reduce and ideally not have to inject drugs. There are other ways with snorting drugs we can catch hep C. Through contaminated blood transfusions, we can acquire hep C. And B, much more infectious, so we can, if we're living closely with household contacts, we can acquire hepatitis B. So we see certain parts of the world we call hepatitis B hyperendemic. So the African continent, Asian continent, Central America, South America, we live in a global community here in this part of the United States. We have friends, patients, neighbors from all over the world, and there are some regions that are harder hit. We want to make sure, though, that everybody, and we'll talk about this, who needs to, everybody, irrespective of perceived risk factors, gets appropriately screened.
Yeah, we'll talk about that in a minute. One question I have about the virus itself is, we're still coming out of COVID. It's been 4 years. A lot of the conversation around that virus had to do with variants, mutations. Are there mutations and variants with hepatitis?
Yeah, that's a great question. So the reason that viruses mutate and replicate and we get these different variants and strains isn't because the scientists are making mistakes. It's because think about doing something 1 trillion times a day. If I was going to make 1 cookie a day, maybe I'd get it right. If I had to make 1 trillion cookies a day, I'd probably make a lot of mistakes. Hepatitis C is a very rapidly replicating virus. It makes 1 trillion copies a day in a human host. If I have Hep C, and maybe I do, I'm making 1 trillion copies a day. So that makes Hep C prone to error and replication. So as your Hep C keeps making and churning out baby viruses, mistakes are made. And so maybe we start out with a school of fish and they're all the same kind of fish, but suddenly there's a mistake that's made, and that leads to a new strain of the virus and a new strain of the virus and a new strain of the virus. So right now we're aware of about 8 strains or varieties of hepatitis C. And we can test in the blood and we can tell someone, hey, you have hepatitis C type 1, type 2, type 3, 4, 5, 6.
Right.
And so that has to do with the way these viruses replicate and make mistakes.
Right. How can someone take preventative measures from getting hepatitis? I mean, you talked about drug use that in terms of blood and Hep C and what have you. But what are some other ways?
So one of the oldest, safest vaccines that we have is the vaccine to prevent hepatitis B. This is an extraordinary vaccine. It was developed many years ago. It's over 40 years old. It's been used millions and millions and millions of people all over the world. It's one of our safest tools, and it is an incredible preventive tool. Most people who get vaccinated are protected for life. Now, this is really important. We're supposed to vaccinate right at birth. Again, hepatitis B is very contagious and easy to transmit within households. So if we don't want to wait until even a day after birth when we go home to our family, we could catch hepatitis B. Once we catch it, we have it for life. And if you catch it as an infant or a child, you're more likely to develop a chronic infection. And there's no cure. So the Hep B vaccine is over 40 years old. It's an incredibly safe vaccine. And when many people say, hey, Dr. Taylor, I have some concerns, I don't want to get a vaccine, in my mind, I'm thinking, be afraid of the virus, not the vaccine. These viruses go into our cells. They use our intracellular machinery to replicate. Hepatitis B gets into our genetic material, into the nucleus, the center of the cell. Think of an egg with the yolk, and it stays in there. That virus, hepatitis B virus, can cause cancer. I've seen children, when I was working in Sudan, at 10 years old have liver cancer. So some viruses can cause cancer. So the Hep B vaccine is an incredibly safe, effective tool, and really we should all be able to vaccinate the whole world and eliminate Hep B that way. So that's the best way to prevent hepatitis B. We have an equally safe and effective vaccine to prevent hepatitis A. That's the one that's transmitted by fecal oral contamination. So if somebody sprays your tomatoes with water that might contain feces, or we go to a restaurant, someone didn't wash their hands, and we eat some Hep A, we can get really sick. It could be pretty horrible to contend with. If we're elderly, if we have other disease, we can get pretty sick. We have a very safe and effective vaccine to prevent hepatitis A. Also, hand washing is very important. Everybody should be singing happy birthday 2 or 3 times when washing hands. And if we help change a diaper of a baby or an adult, we should always be washing our hands. So that's very important in terms of hepatitis A. E is similar to A, but not very common in the United States.
Right. So in terms of the vaccines, you mentioned that infants should get it soon after birth. For adults, is it similar to what we're dealing with in terms of the flu vaccine and COVID vaccine? Are there updates every year to the vaccine? How often, I guess, should people get that vaccine?
So great question. So we are fortunate that there's a difference between blood-borne infections, and Hep B is spread through other bodily fluids, but these viruses and respiratory viruses. With viruses such as COVID, influenza that we acquire through breathing, we sometimes see with COVID and influenza that we have to have different vaccines every year to keep up. It's very different with hepatitis B. We've had the same old hepatitis B vaccine around for over 40 years, and it really has to do with our amazing human immune system. When we are exposed to hepatitis B, our immune system, that's the fighting cells and organ systems all over the body, like soldiers coming out. I imagine people with sabers, because the incredible protein we make in response is called the surface antibody, SAB, saber. And these antibodies are the basis for the Hep B vaccine. They protect us for life. You can never catch Hep B twice. You catch it once, if you make the antibody, you're protected for life. Based on that antibody, Dr. Baruch Bloomberg, who won the Nobel Prize for the development of the Hep B vaccine and the discovery of the virus and the development of the blood test and realizing the virus causes cancer, what happens is he was able to develop a vaccine that gets our body to make this incredible antibody. So we only need that protein in the body, and it will protect us against Hep B for life. One vaccine series. And the CDC said last year, everybody should get screened for hepatitis B. 18 and older, everybody should get screened for hepatitis B. Everyone. And then people under 18, if there are risk factors, get screened. And then everybody should be vaccinated unless you're infected. The only reason not to be vaccinated is because you're already infected. And we should vaccinate everyone, catch-up vaccination. If someone walks in and is 58 and says, hey doc, I didn't have that opportunity, well, let's get you the vaccine right now. The Centers for Disease Control and Prevention says everybody up till 59 should get the catch-up Hep B vaccine, and if we're older with risk factors, we should get vaccinated.
I want to be quite honest. I don't know if I've ever had the vaccine. So I'm that age, upper 50s. So if I'm not sure, can I just get either the catch-up vaccine, or would I need to get, I mean, how would that work?
So the best thing is to walk in, to come see us, and we're glad to help at HealthFirst anyone from the community who wants to get tested. And we have a wonderful health system in Massachusetts, which we can talk about. Many places we can get tested and cared for. There's 3 different tests that we look at in the blood. One little blood draw, if you've been exposed to Hep B, if you're infected with Hep B, and if you're protected. The day you get your blood drawn to see, am I protected? Did I have the vaccine? I didn't know. Was I ever exposed? Am I infected? That's a great day to just get the first vaccine. It's so safe and effective, it's great to get the first vaccine. You can get a 2 vaccine series with one brand, and then there's a 3 vaccine series to complete the whole immunization, and then you're protected for life. So it's great, you get the blood test, we get the results, but in the meantime, you get the first vaccine in your system.
You just touched upon the screening and testing. Is that what the test is, the blood testing?
So yeah, so we have blood tests to detect all the forms of viral hepatitis, A, B, C, D, and E. And so you can get a blood test for hepatitis C. Do I have Hep C or not? Same for hepatitis B. A and E really different because people tend to present sick. We test people when they're sick.
So in terms of, and how often should people be tested?
So everybody 18 and above should be tested once. And then anybody with ongoing risk factors for hepatitis C should be tested frequently. Some people we check every 3 months if they're ongoing risk factors. Some people every year. And B, again, everybody should, if you're tested and you're not infected, you should be vaccinated. For people who do decline, we recommend periodic retesting if there's ongoing risk. And again, anyone, under 18 with risk factors should also be tested.
And those risk factors we talked about earlier, correct? In
hepatitis
terms of,
C.
Yeah, in terms of the Hep C and also the Hep B, if there was any, someone, again, had some history of drug use, that's risk factors. Are there any that you didn't mention?
Sexually transmitted B is even deep kissing. That's why we don't want to wait till people are older. We want to start off right at birth. Household contacts, pus, all bodily fluids, we can transmit hepatitis B. So blood, sexual bodily fluids, other bodily fluids.
So let me ask you, is there any research being done in terms of eliminating these, right? And I know it's always a good time, you want to eliminate disease from our society, but is there work in that area, and how important is that?
There is work in that area, and Massachusetts, I think, is really at the helm. But when we think about infectious diseases, we've been able to eradicate smallpox. That was through vaccination. And so we could eliminate, and even a step beyond that is eradicate hepatitis B. The best tool we have is the vaccine.
Right.
I think what we need to do is start earlier helping people understand, what is the immune system? How does it work? What is the antibody we make against hepatitis B? Why do we base the Hep B vaccine on that? And why is it such a safe thing and wonderful thing to do? We don't want to see a person, and I've, as someone who takes care of people with viral hepatitis for 25 years, I've seen so many young people die of hepatitis B.
Yeah.
And it's a painful death, and people are young, and people are saying, why didn't I just get the vaccine? So it's really important that we help people understand the safety and benefits of the Hep B vaccine. That's really our best tool. Now, if people do have Hep B and they have the infection, we cannot cure it, but we have treatments that help slow the progression, give people a longer, healthier life, and help stem transmission. For hepatitis C, there's been a tremendous breakthrough in the past few years that allows us for the first time to use the term hepatitis C elimination. And that's about 10 years ago, there was a therapeutic revolution. And we went from this old, toxic, nasty chemotherapy where everybody got really sick and hardly anyone got cured, to understanding how the virus replicates in the human liver, using lessons learned from HIV pharmacotherapeutics, and there was the advent of a whole new class of hepatitis C pills called direct-acting antivirals. They're extremely safe. 8 to 12 weeks, we can get 99% of people cured with safe, effective pills. Most people feel nothing. C is for cure. The only virus that we have in the history of human beings that's curable with pills. It's hard to fathom. In 8 to 12 weeks, it's gone.
Wow.
And people feel so relieved, and the stigma goes away. It's a huge burden lifted. And of course, it means that our liver is not going to progress. And all the associated diseases, liver disease not only gets better, kidney disease, diabetes can get better, associated cancer risk goes down. There are myriad benefits to cure of Hep C, in addition to stemming transmission.
Yeah. Let me ask you about World Hepatitis Day on the 28th of July. Why is it a holiday? And I guess maybe talk a little bit about maybe what HealthFirst may be doing to make people aware.
So there are only 5 global health holidays, and World Hepatitis Day is one of them. And really, we work globally with partners all around the world to say, let's all come together, let's share best practices. The World Health Organization just recently updated their hepatitis B guidelines, and we share knowledge and collaborate so that everybody has access to the Hep B vaccine, the Hep A vaccine. We can work to develop a Hep C vaccine, and we can get people treated and cured of hepatitis C and diminish Hep A and E through vaccination. So World Hepatitis Day is celebrated on July 28th in honor of Dr. Baruch Blumberg. He was an extraordinary physician-scientist who got the Nobel Prize for his work on the discovery of the hepatitis B virus in 1976. When he died in 2011, the World Health Organization changed World Hepatitis Day to his birthday, July 28th, in his honor. Also, the birthday of my wonderful HealthFirst medical assistant partner, Gislaid, and we work on viral hepatitis together, so happy birthday to Gislaid then. But Baruch Blumberg saw icterus, meaning he saw that the whites of the eyes for some people are turning yellow, and he was thinking this involved the liver. He was able to detect the virus, develop the diagnostic test for this, so you can get a blood test to detect it when you feel fine. And then he said, I think this can cause liver cancer. Now, in those days, years ago, what do you mean a little invisible virus is going to cause a cancer? This was a very important concept. He was one of the first to show this can happen. Hepatitis B directly causes liver cancer. These are some of the leading cancers globally that can take people's lives very quickly. Then he developed the vaccine, and then he spent his life vaccinating millions. So in his honor, July 28th is now World Hepatitis Day.
So what is, you know, I know HealthFirst will probably be doing a lot of promotion about the event and offering opportunities for people to get screened. Is that safe to say?
So at HealthFirst, under the medical direction of our Chief Medical Officer, Dr. Eric Vaught, the week before July 28th, unfortunately falls on a Sunday, so up through July 26th, there'll be announcements on the HealthFirst website and through HealthFirst social media about prevention, about how to get diagnostic testing, about how to get treated, how to get cured of hepatitis C. What else can I do for my health? And the services in terms of testing and treatment are open to the community, people who are not yet patients of HealthFirst.
Right.
And again, this is under the leadership of our Chief Medical Officer, Dr. Vaught, but my nurse partner is Kelly Da Silva, and she works with me on handling a lot of the expanded testing. I also have to thank the Massachusetts Department of Public Health. Massachusetts could be the first state to eliminate viral hepatitis. Extraordinary leadership at the Massachusetts Department of Public Health under Don Fukuda, with whom I had the privilege of serving the CDC Committee on Viral Hepatitis, and Daniel Church. Both of them are national and global leaders on viral hepatitis. And Don Fukuda in June released a new Massachusetts viral hepatitis elimination plan with goals, milestones, a specific work plan, and that's what we are following at HealthFirst.
Right. As we wrap up here, any final thoughts that you'd like to share with our audience?
I would want to share two things. One is that a lot of excitement with a new, really tectonic shift in testing. Many people don't want to go or can't go and get blood drawn from a vein. Well, guess what? Last month, the FDA approved something extraordinary. We now have a new tool that allows us to prick the finger and within an hour find out, hey, do I have hepatitis C or not? Finger prick testing for the virus. This does not have to be within a lab with laboratory workers. We're going to be seeing in the next months and years that these tools, this is produced by Cepheid in Sunnyvale, California, already used around the world. We're going to see these testing opportunities springing up in a variety of settings to increase access to testing. And here's where we're headed. Simplified pathways to cure. You walk in, your finger prick is done, lights up, you have Hep C, you're handed pills, and you walk out, and you're going to be cured in 8 to 12 weeks. Simplified pathway. We don't need to make this difficult for people.
Right. Yeah. Well, Dr. Lynn Taylor, I do appreciate your time here and giving us some very important information from HealthFirst and hepatitis. So I do appreciate your time. Thank you.
Thank you so much, Keith, for having me, and thanks to all of you. Come on out and get tested. We're here to help at HealthFirst Family Health Center in Fall River.
All right. And thank you for joining us here at FRC Media. I'm Keith Tebow. Have a great day.